Hey everyone, it's Craig with One Man's Cancer Journey, and I thought I'd bring you a bonus episode this week. Trying something new, doing a little video call here with Dale Nusbaum. You may recognize Dale's name from an earlier vlog that we did where we asked for prayers. Dale is a fellow cancer patient, and I thought that it would be a really neat idea if we got the opportunity to hear from another cancer patient because you've been listening to me for the last year. So I thought it'd be really good to kind of hear someone else's story just so that you can have that different perspective. So thank you, Dale, for joining us. Dale's a friend of my brother, Scott. And so I'm glad that Scott was able to make that connection so that we can keep each other in our prayers and then, take advantage of doing something like this for the folks that follow along. So, Dale, I'll just start with, a simple question. Everyone's cancer journey is unique. And would you just share a little bit with us about your journey?
Certainly, Craig. So my journey started in April of 2021, and the diagnosis was biliary tract cancer, also known as cholangiocarcinoma. What happened was it was discovered during a routine physical blood work. I had no symptoms whatsoever. Went in for my physical, and they took the blood. Doctor called back a few days later and said, "Boy, your enzymes, liver enzymes, look awfully high. I think we better do something about that." But her counsel was to wait 30 days and then come back for a retake. So we did just that, and as it turned out, we waited those 30 days, and it turned out that those numbers were significantly elevated, higher than the last one. So my doctor immediately referred me to a gastroenterologist who referred me to a surgeon who had a stent placed in the biliary tract. There was a tumor in the way of one of the tubes, and it was not allowing the fluids to transfer from the biliary tract directly into the liver. So by the time all was said and done, I probably had, I do believe I had two separate stents involved. They tend to have a short, it depends on the cancer, I'm sure, but at least in my case, they tend to have a short shelf life.
Mm.
So we, um, we ended up having to go back in twice for that, but it gave me the necessary relief that my body required
Good.
at that time. So the what I had after that then was a series of radiation, targeted radiation, which I'm familiar. I'm sure many of your listeners are familiar with. And at that particular time, we waited a short while after before we started the chemo, and then I had what's referred to as a resection. So this is when you are diagnosed with this type of cancer, the biliary tract is no longer working. So what they end up doing is they remove the biliary tree. In my case, it was also the gallbladder, and I believe 40% of my liver. And after that is done, they pull up the lower intestine up directly to the liver, and it essentially replaces the operation of the biliary tract at that point. And thank God it has been working ever since. So I mentioned earlier about the radiation, and after that, then I had three separate chemo treatments, each lasting a period of 6 months. And we were also using at that time, toward the end there, we were using a targeted immunotherapy drug as well that was targeting my personal mutation. That's pretty much the story in a nutshell.
Yeah, that's a lot. It's interesting how much as cancer patients we learn about the body and how it functions. I also had some immunotherapy with my first round of chemotherapy as well, so familiar with that. So thank you for sharing.
Yes.
I know that as I've gone through my journey, I've learned a lot about myself. So what have you learned about yourself or your outlook on life that my viewers may find interesting?
So I'm not sure if everyone has experienced this, but at the outset, I did. I actually felt alone. And honestly, didn't know many people that were going through anything near what I was going through at the time, although that has certainly changed since. But we are not alone. We when we're faced with a life and death decision, unless we're totally alone in the world, there are decisions that normally impact the lives of others that we love. So it's not just our life, and it really hit home when um, that whole situation came to fruition. So when it appeared that the drugs were not working, I had informed my oncologist at the time, and that would be back in last April, that I had made the decision not to press on. And so we both did agree to that. We were both, obviously, my doctor, the oncologist, is tracking my history, and the charts were not improving much at all, even though my doctor was doing his best. I really decided to kind of trade a more of a quality of life to length of life. And I have noticed that significantly happens since last April. As those drugs wear off, and it does take some time. You start to realize just how cognizant I was before, and how sharp I was, and I honestly, I have a rich life. I have a family that loves me, and I made that decision, but alongside them as well. And I know that's one of your other questions that I can approach when you're
Yeah,
ready.
no, I appreciate that, and I appreciate your vulnerability to say about how lonely it was, because I found that too. And that's one of the reasons why I started doing this vlog, was I wanted others to know, and not just other cancer patients, but others who care for cancer patients. So I met a woman who follows my blog, and she said that her daughter had cancer, and her daughter was very private and wouldn't share with her what was going on in her life. But as she followed through my journey, she could start to see kind of the different phases that her daughter was in, and so it
Yes.
really helped her in being able to support her from that. But yeah, so thank you for sharing that. As you mentioned, earlier this year, you and your family, you did make a tough decision to stop your treatment. Just share a little bit more about kind of how you came to that decision, and the impact that it's had on your life.
Well, choosing to stop the treatment was by far one of the most difficult decisions I think I've ever made in my life. And it was not a decision. I realized at the get-go that it was really not going to be a decision just based on my feelings and what I want. Even though at times we have those pity parties, but it was not just all about me. So I initially sat down with my wife, and who is also my caregiver, and from there we chose to have a family meeting that would include our two children, our adult children, and and then from there we moved to the seven grandchildren, and which was even more difficult than the first discussion with my wife, of course. But
Yeah, I can't
uh,
imagine.
it was very hard. Was the process difficult? Was it emotional? Oh yeah, it was, and very tearful. But I think it was absolutely necessary to go through that process and just not keep it to myself. As time went on. So,
Yeah,
but
I think it's admirable that you went so far deep into your family. And, you mentioned a little earlier about how when you came off the drugs, you felt, your cognitive abilities increase. And it's funny because I will tell people, I said, that's just the cancer brain that I have. So hearing you say that, it makes, it kind of gives me comfort that yes, once, if, get through this, then I can be in a better place. But, the other thing that I came to a realization with was early on in my treatment, the doctor never talked about a cure with me. He always talked about long-term maintenance.
mhm,
And that hit hard because I'm going to have this cancer for however long I live. And it's about maintaining it. And that it's a different mindset than thinking, hey, I have colon cancer. They go in, they remove it, and I'm good, right? Or prostate, or ones where they can just kind of remove it, and people go into remission. Um,
yes,
Going into a place where you may be on lifelong maintenance it's a little different mindset, and it does take it. But when I was diagnosed, my daughter, my youngest daughter, actually was with me because my oldest daughter and my wife were out of town. And so when they came home, we had a family meeting just like you and talked about, okay, here's what it is, and here's how we're going to attack it. So thank you for sharing your vulnerability and kind of your journey through that decision, which I'm sure was not an easy one, but hopefully is one that has really enabled you to really enjoy the last couple months, as and whatever time you have left. So we appreciate that so much for sharing.
Thank-
So, what advice would you give to fellow cancer patients like me?
Well, as you stated earlier, in the questions that you sent me to review, you indicated that we are all on our personal journey, and we are all on that unique one, that unique trip, so to speak. And most of us are open to and seek out treatment. And I personally think, even today, that is the right approach that everyone should initially take. They just don't know a lot about these types of cancers yet, and every once in a while, the fortunate ones get the right cocktail, and things begin to happen in a positive manner. So, but that too, just never give up. And stay with the oncologist who serves you best. Don't be afraid to step back and get a second opinion if necessary, and be kind to your caregivers.
Well, that's a great lead into the next question, which we've been talking about already today is, when we go through cancer, we're not going through it alone. And so there's so many people that are part of our caregiving team, whether it's our doctors, our oncologists, the nurses, the folks at the infusion center, or our families, right? There's a lot of people that help cancer patients as caregivers. And so what advice would you give those caregivers as they work with cancer patients?
Mhm. Well, one piece of advice I would give is try not to flood your loved ones with micromanaging their life. I know you love them and you care about them, um, and I think the cancer patient needs to have that autonomous feeling along the way as well. Not that we're marching to the step of the of the band. We are, we're a living person, and we need that help. We need patience. I mean, lately I've noticed that I have been very forgetful, and I'm normally not like that, and that can be very challenging for my spouse and for the caregiver.
Yeah,
And so I have to be very careful and work on that because I have not been very careful.
yeah.
But as hard as it can be, um, just try to be patient with that person that either you're charged with that responsibility or your loved one.
That's awesome. Thank you. And one of the things I try to do is I try to make sure that my family tries to live a normal life. So I don't want them to stay behind. I can sit at home alone, right? Go do, they
Yeah,
do Halloween Horror Nights and go to the theme parks. And, like, I don't want them to give up their life because I'm going through this, right? They're there when I need them, but please make sure that they're continuing to enjoy life as best they can during the circumstances. And so I'm just grateful for that. So, well, Dale, I really appreciate your time today. It's been wonderful having the opportunity to speak to you in person because I've been praying for you. And it's just, I thank you for being open and sharing with everyone who's listening. Is there anything else that you would like to add kind of before we close out here today?
I would like to add that thankfully I have a strong faith, and long ago I turned this over to God because I knew that I was not going to do it by myself. And do I have bad days? No question. But I am joy filled in knowing that my future is secure.
That's awesome. I love to hear that. I'm a man of faith as well. And I believe that everything happens for a reason. We may not see it now, but we will know it in the end. So
That's
thank you
right.
so much for your time today, Dale. I really appreciate it. And I wish the best of luck for you and your family as you continue through this journey.
Thank you. And I for you. Thank you.
For my gratitude moment this week, I am grateful for Dale for his willingness to be part of a new experiment for me, to try something new and interview somebody as part of my vlog. So thank you to Dale, and I hope that if you pray, I would ask you to pray for Dale and his family as they continue along their journey with cancer, and pray for me and my family as I continue along my journey for cancer. Thank you for listening. Thank you for following me. It's encouraging to me, and it's exciting to be able to try some new and different things like doing videos. My name is Craig. I'm with One Man's Cancer Journey, and I wish for you a blessed day.